So those are the muscles in the front and the back. We want to talk a little bit about side to side. We have our gluteus medius. It's a muscle about the size of your hand, which is right on the side of your hip in the back part of your pelvis. Its primary goal is it actually moves our leg away from our body. And if we're tight, we actually can cause a shift from side to side in our pelvis. In the physical therapy world, when we're doing a gait analysis on somebody who maybe, again, had been in a wheelchair, or hadn't been walking, or just has a lot of pain in their hip or knees, we'll watch the way they walk. And I'm sure you might see it even, when you're walking around the mall, people get kind of a little hitch when they walk. And that was kind of the first muscle group that we'll turn our attention to. Are they weak? Are they tight? What's going on at the hip and pelvic level that's causing this deviation from side to side? And I think you all can kind of picture this in our day in and day out riding. If we're asking our horse to move away from our leg, and if we're a little bit tight and we're already shifted, what does that do? Our horse is then having to compensate for our center of gravity being pushed from side to side. All right, so a little deeper in our rear ends, this is where we start to get interesting, it is the piriformis muscle. It attaches from the base of your sacrum out to the side of your hip. And its job is to externally rotate our leg. Again, you've seen those people that ride with their toes out. Again, they're probably pretty tight in their hips. And again, we always are working to have that nice full leg against the horse. If you notice though, this yellow line, that's our sciatic nerve. It exits right below the piriformis. And again, in day in and day out practice that I do in our clinic, a lot of people describe this pain that's kind of shooting down the back of their leg. A lot of times we see dysfunction or tightness or inflammation in that piriformis muscle. So for us as riders, that's an area that we want to be concerned about. Again, it's a potential area that if we control and we watch, could help maybe prevent some type of other injury. So moving up to the chest wall, again, the pec group, which goes across our chest, as well as our lats, which are actually on our back, but have an attachment site on our shoulder. When those muscles are tight, they pull us forward and rounded. Okay, again, you've seen the people, or again, if we have to sit at a computer or have long commutes like people around the DC area do, so many of my patients come in and they are just so tight that they can't actually get their shoulders back and down onto their rib cage. So again, if we're being pulled forward by tight muscles, again, that shifts our center of gravity forward in the saddle, again, putting our weight on our horse's forehand, which we're saying, no, 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 carry your forehand up, 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 and we're being positioned forward. Diagrams. And this is a nice picture of showing, again, the red area would be tightness of these muscles. And you can see how the chest wall is slightly kind of rotated forward on that axis. The yellow area are the muscles of our upper back that are consequently being stretched, and therefore, again, stretched muscles are weaker. So after we've stretched muscles and prepared them for our sport, they have to work, okay? Endurance. And we focus on endurance for our horses, the cardiovascular conditioning, so that they can handle the rigors of a cross-country course, again, after coming off of dressage and stadium. So general endurance means the ability of an individual to sustain a low-grade exercise, such as walking, jogging, swimming, cycling, over a prolonged period of time. That's not really exactly kind of what our sport is. Yes, we have to have some cardiovascular endurance, but ours is actually more muscular endurance, which is the ability of a muscle to perform repeated contractions over a long period of time. We're a very fine motor type sport. Again, it's not like swinging a baseball bat or a tennis racket, or again, jumping up for a jump shot in basketball. What muscular endurance is important for is postural control. So again, as we make all those adjustments, again, we're riding a moving animal who's unpredictable and they have a mind of their own. This is our body's way of controlling our posture and our center of gravity, and those muscles are always firing. Has anybody here ever done Pilates or yoga? Yeah. So again, it's kind of actually the hot word in fitness right now is core, because there is a lot of research coming out showing how important the core is to ACL injuries in female athletes. So showing that a stronger core gives them a better base of support and less excessive strain on their knee, as well as core muscles, excuse me, even help with ankle stability. If we're too wobbly and not strong in our core, and again, a soccer player goes to cut and they don't have the control of their midsection, their ankle then compensates for it. So like I said, core is the hot word right now in fitness. So what muscles are actually the core? They are our back extensors, our glutes, our hamstrings, our quadriceps, and again, all the abdominal muscles around our lumbar spine. These muscles look pretty familiar to that original list that we had already talked about. Okay, so the muscles that are important to riding, many of them fall into this core catalog. So going back to each muscle group, now we're going to talk about why strength is important to these muscles as well as flexibility. So strength of our calves, again, increase that base of support, controls our descent in the stirrup as we land over a fence, as well as helps give us that nice, strong, steady lower leg, able to, again, give us that firm base of support. The quadriceps and hip flexors, again, strength and balance can what? Help us control that 2-point galloping position so we can adjust and help our horse over the course of an obstacle, And also the quadricep is a key player in general health to our knees. Again, if we get somebody coming into the clinic with pain or inflammation in the knee, a lot of times we'll look at what's going on with the quadriceps. Quad means 4, there's 4 different groups. A lot of dysfunction can happen anywhere in the quadricep. So again, if one area is not firing properly or not having the right timing, it can cause patella issues. We can get pain under the kneecap. So like I said, the quadricep is a very important group to have both flexibility and strength in. Hamstrings work with the quadriceps in what we call a co-contraction, especially when we're holding that stabilizing position in our galloping point or jumping position. And again, if we have weakness in the hamstrings, it makes our pelvis more influenced to any of those rotations. The glutes and hip stabilizers, again, we talked a little bit about how they affect us in the saddle. And again, with the lateral work, if we're strong and our muscles are firing at the proper time, and again, neuromuscular control, it's a big word, but it basically means that the muscle fires when the body is ready to and it has the ability to react. So again, in our lateral work, again, are we a little slower getting our horse to move from one side to the other? Are they a little stiffer? Do we need to kick in sooner? That's a good, important area to look at, as well as when we land over a fence. Like I told you about people walking who have dysfunction in these muscles, they get kind of this general list to one side. How many times when we are kind of going through a grid, does our horse tend to drift a little bit to one side? Are we weaker in our hip on that side and we're not as quick to correct? Or again, are we landing heavier in one stirrup? So again, possibly it's just a little bit of a weakness or a flexibility issue that through some exercises and focus, we might be able to eliminate that problem. On to the abdominals, one of my favorite groups. I give a lot of people credit. They know that the abdominals are important to the health of their back, okay? Unfortunately, when I ask a lot of my clients what their type of exercises they're doing for their abdominals, they're like, oh, crunches or sit-ups, or I'll lay over the ball and I'll do extensions because I know those are really good for my back. They're good if you have actually the base muscles underneath and you've built yourself up from the core inside to out. So again, the outer muscles, the six-pack muscles, they run up and down. So as you get them to contract, what happens? It actually causes compression on our spine, which again, they're not bad to tone, but for our sport and to protect from, again, sitting trot, landing over a fence, we actually need muscles that support and almost make a muscular brace. You've all seen like the elastic braces people can wear, around the barn, or even when they're riding to help give their lower back support. There's actually muscle fibers, it's called the transversus abdominis, that actually runs horizontally and attaches to muscles in our back. And when those contract, it provides us with that muscular brace. I'm not saying that just toning this muscle is going to prevent an injury, but it's an area that if you're not focusing on, you're missing out on the benefits of it. So then taking a next step out, we get to the oblique group. With these muscle fibers, again, run at angles, so not directly up and down, not across, but they help control rotational forces. So again, looking to make a tight turn in our stadium round. Again, the horse shying, or kind of spooking in a shadow, or a jump judge. These muscles are able to kick in, keep us steady in our center of gravity there, and ready to react.